All right, that was Anatole France with some motivation for you to kickstart your day and your week. With that, I welcome you to the conversation on your digital first Pan-African news network. That's TOS Television, reaching you from Abuja, Nigeria's capital city. And as always, the conversation today promises to be very insightful and engaging. My name is Ade Suwaosui.
And I am Sangir Ibrahim. Thank you so much for joining us on the show.
All right, so we move straight into, stories and development from across Africa. And we're starting from a coup that took place in Guinea over the weekend. So Guinea's special forces on Sunday have dethroned President Alpha Condé after a successful military coup took place in the country. The coup was led by special task forces led by Colonel Mamadi Doumbouya, the head of Guinean Special Forces. Several other top government officials were also captured, TOS News had gathered.
We go to Tanzania now, where in a bid to strengthen its food reserve, the government has issued a $6.4 million for the National Food Security Agency, NFRA, to buy maize from farmers. Prime Minister Kassim Majaliwa made the statement in the parliament on Friday, saying that the government would pay a reasonable price that will enable farmers benefit from the business. Maize production in the country is so promising, and the government has taken relevant measures to enhance our food reserve, the PM said, noting that the NFRA has already received a budget for procuring the maize.
Quite a nice move there in Tanzania. Still in Tanzania actually, so several members of Tanzania's main opposition, Chadema party, that are pushing for constitutional reform in the country have been arrested. This is the latest crackdown on a group. Police detained 9 party members and raided its offices in the northern lakeside town of Musoma to block a planned symposium by the youth wing on constitutional change, Chadema said in a statement on Saturday.
And in Libya, the United Nations Secretary General Antonio Guterres has reiterated that all countries should withdraw their foreign fighters and mercenaries from the country, saying they continue to operate throughout the North African country in violation of last October's ceasefire agreement, with no discernible abatement of the activities. Since a NATO-backed uprising toppled longtime dictator Muammar Gaddafi in 2011, Libya has been stricken by chaos that split the country between a UN-supported government in the capital, Tripoli, and rival authorities loyal to Commander Khalifa Haftar in the east. Each has been backed by different armed groups and foreign governments.
Which one of those stories would you say actually had your thought for a moment?
The first for me is that of the Guinea coup, obviously. I mean, we saw what happened in Mali, and not too long after, we're having Guinea.
Yeah.
I was having a conversation earlier this morning on a previous program, and we're talking about how we are seeing a replication of this coup going on across other African countries because, according to what some people are saying, of the level of bad governance and leadership African countries have been facing and been plagued with for years. So it's not a surprise that it has happened in Guinea, and it will still be no surprise if we see it happen in other African countries as well. I don't want to say including Nigeria, but other African countries as well, So it's unfortunate that it has to get to a point in the 21st century where the military has to seize power from the civilian, the democratically elected, in quote, government, in order to get things back in order, to the way they are supposed to be.
Yeah.
I was reading his manifest, the translated one, and I saw where he categorically stated that the country has been faced with endemic poverty, corruption, a lack of employment, amidst other things he mentioned, which is also similar in Nigeria, which will bring no surprise, as a matter of fact, if we see the same replicated here.
All right, okay. With that, it's about time that we bring you COVID-19 updates from across Africa. And as I would always say, please do the needful to take precaution. I mean, Nigeria has been recording, increasing the number of deaths from COVID-19, and we do not want to keep having those casualties. Please take precautions so that you and the next person is safe. COVID-19 update from across Africa, and afterwards, we'll be bringing you the big story.
You're still watching The Conversation on your digital first Pan-African News Network, TOS Television, and you could be a part of the conversation by connecting with us on our various social media handles on Facebook, Twitter, and Instagram at TOS TV Network. You could also watch a recap of the conversation via our YouTube page, as well as other programs at TOS TV Network. You could also watch the conversation via our website and read some of our contents at www.tostvnetwork.com. It is the big story segment of the conversation, and this morning's focus is going to be on the looming NARD strike, as well as a looming hospital shutdown. And we have Dr. Sunday Olatunde, who is a clinical pharmacist, on the line with us this morning, who will be discussing these issues as well as other issues around the topic. Good morning, sir.
Hello, good morning to everyone in the studio. Thank you for having me once again on the program today.
Yes, sir, you're welcome, sir. So, sir, what do you make of the looming NARD strike so far?
So far, so good. The strike is on. The Nigerians are bearing the brunt. It's important that we make it clear that in any society, healthcare services are very important. They are classified as essential services. No country can do without it. And strike should be the last option for any healthcare professional. Strike should be the last option, as I said. However, with the insincerity of Nigerian government, most of the time when they enter into agreement with healthcare professionals, strike has become an everyday today thing, which is not supposed to be. So for me, with a little level of patriotism from healthcare professionals, ordinarily we should not be hearing of strike in that sector. It's a very important sector that there's no country that can do without it. However, it will have been easy for us to persuade the healthcare professionals not to go on strike. But many times they are on strike not because of a newly introduced points of negotiation, but with an ongoing negotiation with government, in which government entered into agreements, that's memorandum of understanding with them. But the government is not sincere enough to implement what they have, entered into with healthcare professionals. And using different ways of calling the attention of government. When government is not listening, the only thing they will have to do is to go on strike. That is the only thing that will force the people to start calling and putting government on pressure, so that government can listen to their demands. So I would say that it's uncalled for. At the same time, I will say it's as a result of the government's insincerity with healthcare professionals.
Okay. So, sir, talking about the government insincerity now, we've had cases of where the government has said, look, there's going to be a no work, no pay policy put in place if you don't, resume work as soon as possible. And, the essence of the strike, or the reasons that the resident doctors gave for the commencement of the strike, is number one, the neglect; number two, cases of doctors being infected with COVID-19 and even dying on the field because of this COVID-19, coupled with the fact that their hazard allowances were not even being paid, aside the fact that the hazard allowance, according to them, is 5,000 naira. Now, with all of this in place, I'm talking about the dangers, the challenges of being a doctor right now in Nigeria. Do you think the federal government, having not even fulfilled its own bargain by paying these resident doctors, hazard allowance and all other forms of allowance, including salaries that they should have done, do you think they now have the legitimacy to go on saying there's going to be a no work, no pay policy put in place if you don't resume work?
Yeah, thank you for this question. You say by International Labour Organization,
yes.
It is expected that when workers go on strike, the employer is not under absolute obligation to pay the salary.
Yes.
However, the strike shouldn't have been in the first place. It is the insincerity of government that brought the strike.
Okay.
So, because of that, I would say no work, no pay should not be evoked.
Okay.
But ordinarily, if it was not for the insincerity of government, we have to go by the principle and the labor law, which is actually the grand norm that all labor actions should abide by. That is the International Labour Organization tenet, that the employer is not under absolute obligation to pay a striking, worker. However, the strike shouldn't have been in the first place, like I said. It was the insincerity of government. Therefore, government at this point should oblige to actually pay their salary while they are not working, because they entered into agreement. It was not under duress. It was not under with force. They entered into memorandum of understanding with these striking doctors. And if you have mutually entered into agreement, you are obliged to actually obey the tenets of that agreement. And that's where government is at fault in this case. If not for that, we would have been able to pardon government for evoking no work, no pay. It is not only a National Association of Resident Doctors. About 2 or 3 days ago, you heard that JOSU also is also threatening strike, that they gave government just 15 days ultimatum, which is going to last on the 17th of September. And they have their own reasons as well. All of these are fallout of memoranda of understanding that are not actually, implemented for them, which government did not enter into under duress. Like I said, the government did not enter into all of this by force. It was a mutual understanding, and government is failing to implement. So they have their own reason. And if JOSU should join National Association of Resident Doctors at this point, there's going to be a total collapse of the healthcare sector in Nigeria. And we don't want that, because where two elephants fight, in grass there, they are the ones that suffer. So in this case, it's ordinary Nigerians who will need absolutely healthcare services that will suffer. So first and foremost, I want to, or let me say, to add to all that I've said, even though some of the government's positions can be justified, many other positions of government are not justifiable, whether with JOSU or with National Association of Resident Doctors. I would want to say first and foremost that the healthcare professionals in Nigeria should be a little more patriotic and should understand that strike is not the only way to negotiate their ways through to the heart of government. That's number one. But number two, much more than that, is that the higher responsibility is on government. The government should be sincere at all time when they enter into agreement with healthcare professionals. There's nobody who will have an agreement when it is not honored that will be happy. And especially in our own country, where the only language that the government understands is strike, and it's not good for the economy. It's not good for the life of an average Nigerian. I want to plead with NARD to consider and to reach a compromise with government as fast as possible. In this time when we have a lot of outbreak of different epidemics, that they should consider and make a compromise, while government is also advised to take a look at all of these negotiations and do something as fast as possible to allow health workers, one, to prevent the one by JOSU, so that they don't have to go on strike and start another year, months of negotiations. They should call JOSU as fast as possible, and at the same time, continue the negotiation with National Association of Resident Doctors and encourage them to go back to work as fast as possible.
All right. Thank you so much for joining in on the conversation this morning. So it's been really an insightful one. And that's it for the conversation this morning. Remember, you could be a part of the conversation by connecting with us on our various social media platforms on Facebook, Twitter, and Instagram at TOS TV Network. You could also watch the conversation via our website at www.tostvnetwork.com, as well as watch some other programs and a recap of the conversation via our YouTube page at TOS TV Network. Don't forget to like and subscribe. My name is Sagir Ibrahim.
And my name is Ade Sawalsi. Remember to stay safe, and we'll be back here tomorrow.